Okay, perfect. Over to you, Dr. Tina.
All right, great. Thank you. Hi, everyone. Thank you for joining tonight. I'm excited to discuss augmentative and alternative communication in the classroom with you. I am Tina Younes. I am currently in Dubai working with the New England Center for Children, GCC Consulting Division. I have been in the field of speech and language pathology and collaboratively working in the ABA field for the past 9 years. I have just recently finished my doctorate and have extensive experience working with nonverbal kiddos and different types of AAC devices. So I'm excited to share my knowledge with you, share some research with you, and answer any questions you have. So to get started, and as a little icebreaker, even though we're on Zoom, if you have a piece of paper next to you, get it out and fold it into 9 squares. And then in each square, write one word. I'll give you guys about a minute to do this. Can be any word you think you need to communicate. Give you a few more seconds to write those 9 words on a piece of paper. All right, so now I'm going to ask some questions and just be honest. After I ask these questions, I'd like to hear from you guys in the chat box if you were able to answer these questions with the words you wrote down on your piece of paper, or if you found it difficult to answer the questions with those words. So the first question is, what's your name? You able to answer that with the words you wrote down? No. Lots of no's. All right. What did you have for breakfast or lunch or the last meal you ate? Are you able to answer that? Yes. Okay, one yes. Green. Did you eat something green? Yes, but vaguely. Okay. Do you need help? Are you able to answer the question, do you need help? Lots of no's. All right. Are you able to ask for help? Got one yes. All right. Where do you live? Can you answer that? Yes. Sarah's on a roll with her colors, I guess. All right, so I like to start off that activity. It kind of just puts us in the state of mind to think about the importance of the vocabulary we're teaching to our students in the classroom, the vocabulary we're exposing them to, and just how difficult it can be to communicate if you don't have the right either mode of communication or the right vocabulary to communicate. So just to get a little more from you guys as we get started, if you want to just put in a quick little sentence or two about what you know about AAC or the experience you've had with AAC. And if you haven't had any experience, you can also just say that. We've had pecs, signs, and gestures. Lots of pecs. Touch chat, proloquo, great. FCR started, nonverbal communication. Yeah. Great, seeing lots of pecs and proloquo and some touch chat. Awesome. So it looks like everyone here is pretty familiar with the different types. And as we go through, I hope you guys become more familiar with it. So the objectives of my presentation today are to help identify different communication modalities, learn who benefits from an AAC system, state why AAC is beneficial, define different levels of AAC, and understand the importance of functional communication, as well as identify ways to implement augmentative and alternative communication across curriculum, and know where to find AAC support. So I'll kick off with some key terms, and please feel free to interrupt at any point with questions in the Q&A box or in the chat box. Like we mentioned earlier, if you put it in the Q&A box, we won't lose it in the chat as the chat keeps rolling. So the first key term, communication. This is the way we exchange our thoughts and ideas with others. So right now we're doing it via the chat box. Sometimes we do it texting, sometimes we do it talking to our friends. It can be any way we're exchanging our thoughts and ideas. Language is the shared set of words and meaning used with others. So this, you can just think of it simply as being in a foreign country. And if you know the same language, if you don't know the same language, it's going to be hard to communicate or exchange your thoughts and ideas if you're speaking a different language. The third key term is vocabulary. So the set of words understood and or used by a speaker. So for example, that activity we did at the beginning, you guys were limited to 9 vocabulary words, and those were the words you were able to use. Of course, augmentative and alternative communication, AAC for short. These are all the ways one communicates besides talking. Yes, you can definitely get a copy of the presentation after. I believe we'll be sending out the slides. And nonverbal, less than 20 spontaneously spoken intelligible words within 20 minutes. And just to pause here, the research and literature really varies on the definition of nonverbal, but looking across different research and different literature, it usually averages around that 20 spontaneous words within a 20 to 30 minute time span, but there is no set definition for nonverbal. All right. A person is not functionally communicating if nobody understands them. Being understood is more important than how we send our message. And I just like to start off with this to kind of give us that state of mind where we're here to help our students communicate. And just because something's easier for us, or just because we're more familiar with PECS than we are Proloquo, or Proloquo than we are TouchChat, if something else is working better for our students, it's important that we find something that they're working and that they can get their message understood by others. Any questions so far? And please feel free to yell at me if I'm going too fast as well. So let's go through the WHs of AAC. Who uses augmentative and alternative communication? This varies from a person who cannot meet their wants and needs with vocal and verbal speech, a person who cannot be understood by others using vocal and verbal speech, sometimes or all the time. So I've worked with students in the past who we understand them because we're with them every single day and spend a lot of time with them. But when they would go out to their voc sites, they would use some form of AAC because non-familiar listeners had a hard time understanding them. A person who often engages in challenging behavior as a form of communication. So oftentimes providing a student with some sort of AAC system can be a less response effort for them to emit an FCR than it would be for them to learn how to verbally say it. Or a person with less than 50 words in their vocabulary. So why would we use AAC? There are many different reasons, and the list right here isn't extensive, but some of the most common reasons. AAC can help facilitate the development of speech for children who will be able to develop speech. So if you're thinking about kids with apraxia or young kids who are emerging communicators and have delayed language or delayed articulation. Research and clinical experience show that the use of an AAC device with children does not block the development of speech, but it's now used successfully with very young children who are at risk. And this is a common question that parents often ask. They fear that the use of an AAC will either make their child reliant on the device or will just stop them from developing that language or speech. However, our research is showing that it actually helps develop speech and develop language, especially expanding language and utterances as well. Yes, it's a very common question. That's usually the first question I get from parents is my child going to be lazy? Is this going to make them stop talking? But there is a lot of research now and even more research coming out that is really supporting the opposite of that. And I think it kind of seems counterintuitive, but the thought behind it is that this child is exposed to a multimodality of communication where they're seeing an icon, they're hearing it, they're seeing the word above it, and all of that is consistent for them. And so they're able to start pairing it, whether they're learning it visually or auditorily, it just becomes more of a consistent method for them to be exposed to language and different vocabulary. Speaking of consistency, being consistent with an AAC system can help increase and promote independent communication. AAC systems with visuals ease the demand of generating vocabulary. So if you have a student who has a lot of language, they understand a lot of language, and they have a lot of maybe one-word utterances, sometimes using an AAC device can help build their length of utterances because it's taking that demand of generating vocabulary. It's visually available for them, so it helps them pull and put together sentences depending on the device you're using. AAC also offers an individual a way to express their wants and needs in a functional manner, and it can support a gap in receptive versus expressive language. So what are different modes of communication? Many of you listed a lot of your experience with AAC, and I think we hit almost all of this. Different modes include anything from sign language to picture exchange communication systems, PECs, the pod system, speech generating devices, whether that's a high-tech or mid-tech system, picture boards, writing or typing, texting. We communicate in a lot of different ways, just day to day, even outside of thinking of our students with communication needs. Any questions so far? All right, so are you guys currently using any communication or modes of communication in your classroom? What modes of communication are most commonly seen in your classrooms? Assuming you're all in the school setting or whatever setting you might be in. PECs. PECs, Proloquo. All right. Touch, chat, sign language. Awesome. Glad to hear it's being implemented and used in the classroom. That's great. Gestures, yep, electronic devices, all of those. All right, so we have all these different modes of communication. How do we decide which is best for the student or the user? The goal is really to find something functional and individualized. On the slide, I put one of my favorite quotes. Having a communication device doesn't make you an effective communicator any more than having a piano makes you a musician. So oftentimes we might find a device that's working for a student, we give it to them, and everyone's like, well, why aren't they communicating? Why aren't they doing this yet? Why aren't they doing that yet? But just the same way we learn language and we learn how to communicate, it's a developmental process, and they need to learn the system, they need to be shown how to use the system, and it takes time, just the same way as having a piano takes time before you can call yourself a musician and learn how to play the piano. So when we're deciding on a device, it's important to consider many different factors, and this can be the family, their family wants, the family needs, the student's lifestyle, as well as the family's lifestyle. Is this a student who is ambulatory, who is going from school to after-school activities to maybe a vocational job or in home? Or is this a student who has higher communication needs and is really just going from their school, to the house, to doctors' offices. What language is the family speaking? What language is the student speaking and understanding? And as well as their culture. So different cultures might have different needs in terms of the vocabulary we're putting in the system, the way the system is seen when they're traveling or when they're in the community. And motor skills, how is the student able to access their device? Are they motorically able to access with their hands, with their feet, with their head, with their eyes? What is their most reliable motor skill? And same with visual and auditory skills. Can they see? Can they see? Do they need any corrective lenses? Do they need any changes on the device? And auditorily, can they hear? Can they not hear? How can we support them auditorily? iPad apps are considered AAC, and it's, yes, so there are many different, sorry, I'm jumping into a Q&A. The question is, are iPad apps considered AAC? iPad apps as in something different than Proloquo, because often some parents can't afford it. So there are several different iPad applications. There are even different apps in the Apple Store versus the Google Store, and many of them can work as AAC. It's more of just making sure it works for your student and how it's set up in the way that we can set it up. So there are many that are a lot less expensive than Proloquo, and that's usually just because they have different features. But as long as it's working for the student and the family, then that's what we're looking for. Hope that answered your question, Mary. Thank you. Another thing we need to look at is scanning skills. So how big of a field or an array is the student able to scan? Can they scan and discriminate across 2 pictures, 12 pictures, 25 pictures? This helps us decide how big the device needs to be, how much vocabulary can be on one page at a time, and kind of helping them grow from there. Another thing to consider are the vocabulary words. So what words do they know right now? Do they have mastered? What words are they still learning? How much vocabulary receptively are they showing that they know, and how much are they still learning? And then the different settings. So kind of going back to the iPad app questions, every system has different settings and different ways that you can individualize it. And that's sometimes really important for kids who might have more complex communication needs or medical needs. Whereas typically students who may be mainstreamed require less of those individualized settings where you're hooking things up to switches or working with different release and button styles. And then the last thing to consider are the communication partners. Who is the student talking to? Are they talking to their teachers and their families? Are they talking to their peers and coworkers and their family and their teachers? And just considering kind of everywhere and everyone that this student might come in contact with and will need to learn how to communicate with functionally. Any questions so far? All right, so some other things to consider when we are deciding on a device. There's no standardized or research-based assessment as of yet to decide or to administer a test and be like, oh, you're matched with this AAC system. It really is a lot of trial and error, a lot of trial with diagnostic therapy. Something I've always been taught and stick to is trialing 3 different levels. So kind of where you see the student succeeding, something a step above that and something a step lower, just so that you are covering all the bases. You're not underestimating, you're not overestimating. And then you can really see how they perform across these different trials to make sure that we are matching them with their best method of communication. And then it's important to include varied vocabulary. So diagnostic therapy, that's a great question, thanks, is just spending time where you are essentially trialing the devices and you're doing therapy to kind of come to a diagnosis of which system might be the best for them. So they're coming to therapy, you might trial a system for a few weeks and then move on to a next one and then compare the data to see which one they were most successful at. Or it might be a session by session where one session you trial something, take the data, the next session you trial something else, take the data and compare and see kind of where is the student succeeding most, which device do they seem to be buying into more and understanding more. You're welcome. So it's important to include varied vocabulary. So in the speech and language world, we use fringe words and core words. So fringe words are typically those nouns and individualized words. They make up about 20% of your vocabulary, and they're more specific to certain things. So if you go into McDonald's, fringe words would be things such as Big Mac and French fries and Happy Meal. Those are words that you can really only use in the McDonald's setting. Whereas core words, they make up 80% of our vocabulary, and they're thought to be more generalized words that you can use across settings, across situations, across cultures, across people. And these would be things such as your verbs or things to socially that you're introducing yourself with. But like run, go, come, help, more. So it's important to include both of those in a vocabulary system because we want our students to be able to engage in those nuanced conversations that are specific, but also have the vocabulary to talk to many people across different settings. So what are some myths behind AAC? The first and biggest one I kind of touched on earlier is that it hinders speech development or it hinders language development. That it should be used as a last resort for speech or language intervention. And this kind of goes hand in hand with the first one, where we don't want to use it because it's going to hinder their development. That prerequisites are required. There really are no prerequisites to communication. It's more of finding a system that works with the skills that the student has at the moment, and then growing and constantly being aware that they might grow out of that and be ready for something new as they continue to learn other skills in their life. And the final myth I could put on here is that a user must be nonverbal. But as you guys already know from the first slide, there are many different users who are using AAC. It might be all the time, it might be sometimes, but they don't necessarily have to be nonverbal. Have you guys heard of any other myths being in your placements? Or anything you're wondering if it's a truth or a myth? You can play Mythbusters for a minute. I cannot teach a child to be bilingual. That's a good one. There are a lot of new systems that have multi-languages in them, and even systems that allow you to code switch within them. Yeah, prompt dependency. Using an iPad will increase child's desire to play on iPads. Yes, that one gets brought up a lot, that we don't want to increase screen time for our child, so we don't want to do this. It's a tricky one there. Yes, those are all great points that do get brought up often. All right, so now I have a few videos I want to share with you guys. The reason I like sharing these videos, it really shows us a perspective on real users and real stories. And I think oftentimes when you're going day to day in work and you're trying to find a system or you're trying to find a way for a child to communicate, we're really focused on ourselves and our tasks and what we need to do. And sometimes we get a little bit removed from that empathy and being in their shoes and understanding what they need, what they might be able to advocate for them if they had that communication. So I kind of like to start with these videos before I get into the classroom stuff to help us think about just these students as people who have different needs and who have different wants and desires. So this first one, I am just going to share the first 5 minutes of it. It's available on YouTube. It's actually an hour-long documentary that is really great. So if you have time on your own, I definitely recommend watching it. All right, I hope everyone can share it. I mean, hear it.
I don't talk as fast as you would. just my body. Does. Yours does. It's just my body doesn't do what yours does.
I get A-S-S-U assumptions made about me and are I miss out on N C O N N action or maybe they miss out or it's frustrating because we are living in a time where it's fast-paced and nobody slows down for anything, so when they don't allow me to answer or I am too slow, I get assumptions made about me that are wrong, and I miss out on that connection, or maybe they miss out, or
All right, so I'll stop at that one there, and then I have another one to show you guys. So this man has a YouTube channel called Mr. Toes' Lessons, and he does a lot of these short clips I'm about to show you just about what it's like to be an AAC user in the community and different pet peeves of his as an AAC user that people often engage in when communicating with him. All right, and one last video to share with you guys, and then we can spend some time chatting about them. This next video, if anyone here is from Colorado, may know this lovely couple. I'll play the video and let them share their story, but I know them personally. Unfortunately, Rick has passed away this summer, but he would be delighted to know that he is still a part of educating everyone because they both really like educating and sharing their experiences with everyone.
I love you.
Love you too. Talking on the phone and the call is going into the talker, so the phone and the talker, Rick's phone and his talker are linked together. So he hears me through the talker.
I love you, Bob.
All right, see you.
For the Arc of Larimer County's 6th annual film festival, we had the chance to sit down and talk to Rick and Lisa. Lisa was born blind, and her husband Rick was born with cerebral palsy. Cute couple, right?
Let me say at the outset that I'm not a genius. I just did what I needed to let people know there was a real person inside this body. I have cerebral palsy.
I was gonna stop that video like 10 different times, but you guys kept commenting, so I figured we would watch it all. It's one of my favorite videos. Rick and Lisa are an amazing couple. But I'd love to hear from you guys what you thought of all three videos, any takeaways you got from them. You're welcome. I'm glad you all liked them. It's like being in a jail within your own body. Yes. Teaching communication is important. Yes. Focus on wait time, yeah. Yes, all of those things. And I think for me, I've always kind of worked with the younger population. So you lose sight of who are these people going to be as adults? Who are they going to be around? Who are they going to marry? What's their life going to be like? We're so focused on the here and now and the developmental progress and what's next year going to look like? What was last year like? What are 2 years going to look like? But really thinking big picture. And like Rick said, if someone wouldn't have sat down and been like, wait, you can read, he would have never had the chance to get a communication device to learn all this communication. And so it really shows us that we can't assume things, and we should always test. We should always give them the opportunity to show us what they can do. And that kind of brings me back to why I like to test different levels of devices, kind of going above where I think they are, because who am I? This is just what I'm seeing and what they're showing me on the day-to-day. But if I'm not giving them that opportunity to show me more, then why would they ever show me more? Yeah. Yeah, if he was never able to use the communication device, he would have never been able to express his thoughts and feelings. Yeah, communication is powerful. Also, before I jump back into my presentation, I totally forgot my one job to tell you guys to keep an eye out for 2 code words. You will have to write those down somewhere where you can have them later to fill them out for your CEUs. Do not put them in the chat box. This is just for you to remember to get your CEUs later. Sorry, I forgot until now. All right. Any other questions or thoughts before I get back into it? Let me just pull up my chat box again in case anything does come up. Yes, no code word yet, but it's coming right now. So let's talk about the different systems. There are aided and unaided systems. Unaided systems are things that do not require additional materials or tools. So this would be something like sign language, where you're just using your body. You have what's available to you as a person to communicate. So this could be gestures, sign language. Then there's aided AAC, and this is the addition of material to one's environment to help with communication. And with aided AAC, we have different tech levels. This can be low tech, mid tech, or high tech. And then within that, we have different styles of high tech systems. So this can be static versus dynamic. A static system stays the same always, regardless of manipulation. So this would be something like a picture board or icons that might be on a student's desk. That's always there. When you touch it, it doesn't change, it doesn't move. It's always in the same spot, in the same place every day. Whereas a dynamic system is always changing. So this would be something like Proloquo or Touch Chat, where you click a button, it navigates or visits to another page, it takes you to somewhere else. It can also be a textbook because those pictures are always kind of moving when we put them back in the book. And then we look at selection. So within the different systems, is it going to be a direct selection? Meaning, is the communicator using their body to directly access the system? Or is it indirect selection? They're using a switch or other method to control the device. And this could be a head mouse, a switch, anything alternative from their body. Any questions so far? All right, so let's talk a little bit more about low tech. So low tech requires minimal to no technology. This can be things as paper and a pen, picture boards, PECs, where you just have the book and the icons. Some pros to low tech AAC. It's great for short term or last minute needs. You can kind of throw together a picture board if you need to. It's great for persons with challenging behavior. Persons, you're welcome for my good language. For people with challenging behaviors who may have a history of ruining technology or throwing different devices. And it's great support if a battery runs out. You don't have to worry about charging it. You don't have to worry about plugging it in or finding a place for it. And it's good for minimal communication needs. If it's just for a specific situation and you just need these certain things, you can throw it all in there and you don't have to worry about all these pages, all these pictures, all these icons. Some cons, it's really hard to maintain with vocabulary growth. So if any of you have kids who have been using a PECS book for a long time and their vocabulary has grown a lot, there are icons bursting out of that book, falling out of that book always. You're losing pieces, you're losing pictures, you constantly need to keep up with adding them, and it just takes a lot more work to upkeep, especially when you're thinking about a student who might be going from music class to art class to math class. There's just so much vocabulary and different vocabulary they're exposed to that can make low tech a bit challenging. So looking at some examples, this is just a picture board, a whiteboard where they might be just writing specific words that are hard for them to say, sign language, a PODS book, and a PECS book. So oftentimes we hear the word PECS being used as just an icon. However, PECS is an actual system and it's a communication system. So we have those board maker symbols or different symbols and different icons that we might be using as visual support, but it's not truly PECS unless there's an exchange and it's happening as a form of communication. Any questions about low-tech AAC or any stories you guys want to share about your experiences with low-tech AAC? All right. So then we go into mid-tech AAC, and these are systems that require some technology, not as high-tech as an iPad or a device from a company, but kind of in the middle. Some pros to that, expanded vocabulary on a budget. So it's a great way to work with a kiddo who has a lot more vocabulary than they can upkeep in a PECS book, but maybe they can't afford an iPad and the apps on the iPad. It's a step towards higher AAC. So if a kiddo is still learning cause and effect, or if they're still learning how to be safe around electronics, this is kind of a step towards that in a way to get them used to those different aspects of using a high-tech AAC system, such as selecting cause and effect, scanning bigger arrays. Yes, low-tech AAC is very helpful with high behaviors, especially for, you're totally right. I've worked with a lot of students in the past where we just put a break picture on their table or an all done picture just glued on their table, and all they have to do is touch that. You can also do that with mid-tech, just have a button programmed. That button can be put somewhere, it can be carried with you all the time. Just one hit on that button gets them that FCR that they need to communicate in the moment. Some cons to mid-tech AAC, it can be, again, limiting vocabulary. It's usually battery powered, so while you don't have to worry about charging it, every now and then you're going to have to worry about changing those batteries. And then it also typically provides a closed set vocabulary, and that just means that we're providing a set of words, and there's no really way for the student to communicate beyond those set of words if they don't have the means themselves to do that. So looking at the examples, that closed set vocabulary might make a little more sense. Yeah, so a Big Map button is this big red one. And mini me's are essentially smaller buttons that are square. So the Big Mac, you hit the button and you record a voice saying something. It could be break, it could be I want more, or I need the toilet. So they push the button and it just voice outputs the recorded message. And it's the same with a mini me. They're little pocket-sized I used to program these for students I worked with for Halloween, so they could take it out, push the button, say trick or treat, move on to the next house. So then their family didn't have to worry about carrying their candy bucket and their AAC device and this to every house. It just made it a little bit simpler to put that button on their candy bucket and go from there. Yes, it's also great because you can program it in any language. There are also buttons where you can multi-select. So it's one button, you hit it once, it says hello, you hit it twice, it says how are you, you hit it 3 times, it says goodbye. So you're kind of pre-programming a conversation as well. That was a great question. Any other questions? I'm a big fan of the Go Talk as well because you can create kind of topic boards. So if you're in music class and you want the student to be able to sing along or fill in certain parts of a song, you can create a board for each song and have those icons ready and teach that student to kind of go along with the song. We used this once when we were putting on a play with our AAC users. Instead of taking their devices and teaching them how to navigate through their devices to every line of the play, we got them each a Go Talk and just put their lines on the play for that. So they knew when they saw the Go Talk, it was time for the play, and they knew exactly which buttons to hit at which time, so they could say their lines in the play. All right, so now getting into a high-tech AAC. Sorry, I'm just reading Aisha's comment that I never knew there was a type of AAC between either pen, paper, pictures, and the high-tech ones, such as iPad. Yes, and oftentimes those aren't really seen, I would say, in the schools. I've seen more of these like in more clinical settings where they have a plethora of different devices, but there is definitely an in-between, and I can send out some links to Dr. Kelly to send along of where you can kind of access these and find them and learn more about them as well. So getting into high-tech AAC, these are the more complex technology systems that we all may be more familiar with, such as iPad apps, eye gaze devices, computers. Some pros to these, it's really allowing us a vast vocabulary and allowing the student access to a vast vocabulary. It's easier to maintain, to modify, to expand the vocabulary. It's providing more of an open-ended vocabulary because it allows them to add any word they want at any time. They can type, we can add in recorded messages, pre-recorded messages. It's easier to be understood by everyone. So if you think about a textbook, if a kiddo takes up his sentence strip to a stranger, that stranger is going to be like, why is this child handing me a piece of paper? Whereas if a student went up and said, I need help on their device, that's going to be a little more easy to understand than arbitrary icons in an unfamiliar environment. They're also easier to transport. You don't have to worry about icons falling out. You don't have to worry about taking the pages along with it. And the cons, that they are very expensive. It requires a lot of training for the caregiver and the teacher and the student to use and to navigate. And it can be hard to carry or access across environments. So I worked at the New England Center for Children in Boston, and all of these kids attended swim lessons each week, but about 80% of my caseload used a high-tech device. So they were going almost into 2 hours if you're considering the locker room and the pool time without access to their communication devices. So what we ended up doing was giving them a low-tech option in the pool. So we put icons on float boards, and then we filled a giant pretzel jug with icons in it so that it would float on the water. And then they had at least access to some of those common or needed FCRs in the water. And different examples of these are just the iPads with different applications, the Tobii I series, the Accent 1000, all of those high-tech systems. Any questions about the different levels of technology of AAC? Can you share with us practical experiences on how you tested the tech levels with your students? Yes. So a lot of it, it's quite the long process. I am lucky enough to be in a setting where I can kind of go in and out and see clients day to day if I need to. and I think that's a little bit harder in different settings. However, I usually start with just observation, seeing how they're engaging with different toys, with different iPads, if they are using an iPad for leisure activities, to see what their ability is to understand cause and effect, to take care of devices. And a lot of it is family discussion. So I usually don't jump right into high tech unless I know the family would be willing to do that. So a lot of it starts with those initial family discussions and team discussions of what do we think is best? What do you guys want to see? Is this a short-term thing? Is this long-term? Because we don't want to be recommending a very expensive high-tech AAC system if it's just a short-term need, or if it's just for a specific setting, then a low-tech or a mid-tech option might be more appropriate. I don't know if that really answers your question. Like I said earlier, there's not really a set in stone assessment, but yes. Another question. Have you ever found high tech to be more effective for a kid who can't seem to discriminate between pictures? This child is well versed on the iPad for leisure. Absolutely. So a big part of AAC systems, especially the high tech ones, is that motor planning. So if discrimination isn't, if they're able to scan across the screen, discrimination isn't always a barrier. Again, it depends on the child. So if he's able to pick up that motor planning and understanding those at least auditory discriminations, or that discrimination between I pushed this button and I got something I wanted, I pushed this button and I got something I didn't want, then yeah, that discrimination becomes less important. So I've worked with kids who aren't really attending to the icons, but have learned the motor plan and can accurately ask for what they want. Whereas other kiddos, they're just navigating until they hear some sort of output, but not necessarily understanding that they have the power to change what's coming out of there. And that's when I do look more into that discrimination. Does that answer your question, Jen? And then, yes, and then Jennifer, what do you do when you get pushback from others who say that it's not functional for people to carry on those devices? I feel like parents always say they know what their child needs, and no matter how many times I explain that the work needs to be understood, the world needs to understand them too, it doesn't seem to help with some parents. Parents can be very frustrating at times. I definitely agree with that. And I think a lot of times what I do is I share all the information I have about it. I ask them if they're okay with going along with a trial at least to see how their child reacts to it, how their child picks it up, and then making a decision at least after we've provided that opportunity. So not necessarily forcing it on them, letting them know it's an option, letting them know we don't have to decide now, we can trial, we can see how the student picks up on it before making a decision. I've worked with families that are resistant to trialing using device at home, even though, yeah, and I think a lot of families do have a difficult time transferring it into the home. Sometimes it's seen just as an academic tool versus a communication tool. And I also think the family may have just spent thousands of dollars on this and they're terrified to mess it up or to break it. And so I think if you are able to provide that extra support and that extra training to make the family more comfortable with it, then you oftentimes see a little better outcome of that generalization at home. What is motor planning? That's a great question. So motor planning is the ability for our brain to kind of remember the steps we do, the motoric steps we do to achieve something. So if you think of riding a bike, you don't have to think about pedaling every single time. Your brain has kind of learned that pattern and that motion. Or if you think of typing on a keyboard, if you know how to type, you don't have to pick and peck every time. Fingers just kind of do it because you've learned the spot every single time. And so motor planning is important with high-tech AAC in remembering we shouldn't always be moving their icons. We shouldn't always be changing the system. Another thing to think about with motor planning is your phone. If you have an iPhone or an Android and you have the apps, if someone took your phone and moved all the apps, you're going to have to spend time looking. You won't just be able to unlock your phone, type in your password, and find the app you want. You're going to have to scroll through it. So motor planning in simple terms is the ability to do something without thinking about it. Does that answer your question, Alette? Yes, of course. Any thoughts on the barrier of stimming non-functional use of high-tech devices? That is a great question and something I was just discussing with my team today. I really rely heavily on the BCBAs on my team when a student is stimming or scrolling a lot through their device. What we've typically done in the past is treat it like a verbal kid who's engaging in vocal stereotypy. So what would you put in place to decrease that vocal stereotypy? How can you stop them from doing that without taking the device from them? So I think it's very specific to that student's behavioral programming and kind of what's going on and working with it as a team that way. Do you know of any funding AAC devices for parents? Mary, where do you live? Wisconsin. So I'm not familiar with the state funding that's available in Wisconsin. However, there are typically each state has an AAC team. So it's called the SWAC, statewide AAC team, and they can often provide funding. Different insurance provides funding. There is a website I can send along as well that will kind of take you and navigate you through the funding steps. So you might be able to get more information specific to Wisconsin by following those steps as well. Yes. Any other tech questions, or should we move on? Happy to go either way. All right. So how can we incorporate AAC in the classroom? I think before we get started into these slides, the biggest thing to think about is collaboration. So collaborating with the general ed teacher, collaborating with the special ed teacher, collaborating with the BCBAs if you're lucky enough to have them around, or if you are a BCBA, collaborating with the SLP you have around. Teamwork truly makes the dream work when it comes to AAC, and even more so when we're thinking about integrating it into an already busy classroom. So an individual AAC system is a system used solely by the communicator. It's individualized and customized to that communicator's needs and lifestyle, and that's kind of what we've spent up till now talking about. And something important is that it should always be available. So going back, I kind of touched on it earlier with families, that AAC systems can sometimes be viewed in or thought of as an academic tool, when really it's a communication tool. So it shouldn't only be available at the student's desk. It shouldn't only be pulled out during circle time. It should be always available, the same way every other student in that classroom is always available to talk. They might not supposed to be talking, but they still have the chance to talk. And then we have classroom AAC. So this is a system available for all to use. It may be provided in certain lessons or settings, and it's commonly being seen on a lot of playgrounds in the US. Downey and colleagues actually published a short article in the ASHA Leader. It was titled Integrating AAC into the Classroom. And one section I wanted to highlight from this piece of literature was that no system is a cure for the academic or communication needs of a developing child with a communication or cognitive impairment. Rather, AAC is a process that enhances the child's ability to communicate. Clearly, there will be instances when using just one low-tech or high-tech solution will not be viable in the classroom setting. Therefore, the challenge of the IEP team is to identify multiple strategies and pair them with the right classroom activity to allow for ease of integration and opportunities for communication or learning. So again, we just talked about low-tech, mid-tech, and high-tech, and that's not just because we want to select one for a student to use, but we want to be aware of all of those to figure out how and what's the best way of communicating in each setting when a kid's at school or at home or at work or wherever they might be. We're all multimodal communicators. We all use our hands to talk. We text, we call, we type, we send emails, we write letters. Maybe I'm the only person that still writes letters, but we're all multimodal communicators. So how exactly do we go about initiating and integrating an AAC system? One thing I'd like to show you is a curriculum tree or a participation plan. So Gloria Soda and her colleagues mentioned that a considerable body of literature showing the effective use of inclusion programs, right? Like we all know how important inclusiveness is and inclusion programs. However, that also requires some changes in the structure of the classroom or different ideas of the professional's role and continuous need for collaborative teaming in these settings. So instead of having a team of people, you want to be more collaborative in working together. So let's see if this links up correctly. So this is a curriculum tree. It can also be called a participation plan. But essentially, when you're writing the kiddo's IEP or when you're sitting down and collaborating with the team, you go through and see what activity do we see a better need for communication in. So for example, it might be circle time. And instead of using their high-tech device, because the topics are always changing and they don't have that robust vocabulary yet, or they're not able to scan a large array to keep up with the class, maybe we provide them a low-tech topic board for that daily lesson. So then they have the opportunity to at least point to the words that they're trying to communicate during circle time, and they can engage in the activity or the topic of the day. Or for recess and lunch, in that first video, they talked about how fast life is. So think about these students who are in an elementary school and their friends are running and playing and jumping and talking a million miles a minute. Would it be beneficial to put pre-programmed phrases or questions into their device so that they can keep up on the playground and at lunch with their peers? Or does their device have the school lunch menu on there? Are they able to advocate for what they want to eat, what they don't like, what they might have allergies to? And then reading groups. There are different books that you can get with the navigation pathways or how to scaffold comprehension questions for the learner to be able to answer them and engage in reading activities with their communication device. Another way to focus on integration of AAC, this is actually from the Wisconsin Assistive Technology Initiative Department. So Mary, that's also a resource I totally blanked on sharing with you. However, they share this classroom observation guide. They do it at the start of each IEP, I believe, and they kind of go through the student's routine. So what is the task that is required? What are the directions given? How long do they have to do it? And then what are their typical peers doing? What is the target student doing, and then what is the barrier to that target student matching their general peer, and what are things that we can put in place? What are questions we need to ask to follow up on, and what are just some assistive technology that we could put in place for them to be more successful in that area? Any questions or comments so far? All right. So other ways to just initiate that integration of AAC is through in-house trainings for your staff. I often do this for peers. So if I have a kiddo who has some communication needs, whether it be complex with a device or more general and just delayed, I ask the family if it's okay. And then we have a peer presentation to teach the peers how to be a better friend to that person. Telling them, the peer, that it's okay if you don't understand, you can say that. Here are things that they have troubles with. Here are things that they're really good at. Here are things that they like. And it also helps the peers feel more comfortable around those students because they have a lot of answers to questions that they might be shy to ask, or answers to questions they didn't even know they had. And doing the same with teachers in the classroom, music teachers, PE teachers, the art teachers, those specialist teachers who might not be seeing the kiddo every single day or as often as the general ed teacher or the paraprofessionals. Really relying on the paras or the teacher's aides or the shadow teachers to have that focus and have that advocacy of using the different system, helping them feel comfortable with the system so that they can then advocate and make sure that the student is supported throughout their day. Because if the shadow teacher or the teacher aide or the para isn't comfortable, then who is the student able to rely on throughout the day? Because the BCBA, the SLP, isn't always going to be there every day, all day. And then, like I mentioned, student and peer lessons as well. Any questions so far? All right, so let's get into math and AAC. So some different ideas for integrating AAC into math classes. This can be as simple as adding visuals for placements or color coordination to help explain different place values. It can be using switches to control spinners or other devices. So this alternate switch in this picture, that big orange button in the bottom corner spins it. So you don't need, the kiddo doesn't need to have that fine motor ability to flick the spinner, but you can also hook this up to a button where they just hit a bigger button and then it spins it for them. For math, for specific classes or units, providing low-tech picture boards for those lessons. So like we talked about earlier, for example, in circle time, you might need to do the same in math. If a kiddo is still learning their device and isn't able to learn different navigations and different vocabulary all at once, that's a great time to bring in some low-tech to augment those needs in the meantime. And then providing visuals with word problems. So if a kid is using a high-tech device such as touch chat, you can jump into chat editor, type out the word problems with their visuals, with their icons, so that they have a better understanding of what that vocabulary means. It's more in a more familiar format presented to them. And then using partner-assisted scanning. So sitting down, working with them, reading things out loud, giving them choices verbally and letting them select slowly and not at so much at the classroom pace to help with that as well. Can you guys think of any other ways to integrate AAC into a math class, or have you done anything else? Losing steam from you guys. We were so chatty just a few minutes ago. Touch counters, yes, that's a great one. That, yeah. Boom cards. Gotta love boom cards after Zoom. I didn't even know they existed before COVID. Counters, yes, counters are a big one, especially thinking of a lot of our kids who might have communication needs, having additional visuals, whether it be counters or actual visuals with word problems, those are a great tool to use. Boom cards, you guys don't know what boom cards are? So Boom is a website, and I think it's just like boom.com, and it's essentially interactive activities and different interactive units and lessons that you can do with the student. I used them a lot during Zoom for a lot of different like language and articulation lessons, but they have literally everything under the sun that you can use there, and it's all kind of set and ready for you. Some of them are free and some of them you have to pay for them. I love touch math. Yep. Great. See, you guys have great ideas. Yes, definitely something you can use in higher ed. They have different levels and a variety of things on there. Boom cards. I also just learned about it during COVID and Zoom. There it is, Boom Learning. All right. I feel like Boom Learning is totally going to steal my steam from this. Everyone's going to be so excited about that. All right, language arts and AAC. So how can we integrate AAC into language arts classes? Again, using that visual assisted text, I put some pictures right here to kind of see what I mean, where you're using the device icons, if they're using a high-tech device, to show them the navigation sequence maybe, or what the vocabulary is. Reading aloud text. So just because your student might not have literacy skills, that doesn't mean they don't enjoy reading. So if it's silent reading time and they can't read, having someone sit next to them and read. You can do student paired reading. You can, again, give them the navigation sequence for them to follow along in a book, at least with their device, and navigate that way. Filling in the blanks with visuals. So instead of giving them a word bank of vocabulary words, putting those visuals instead. So I see a brown and then having pictures of a bear and a bird and a frog and letting them pick the correct one. Using storyboards, a lot of classrooms also have vocab boards and all like thinking of adding in visuals. So if the word of the week is flamingo, also having a picture of the flamingo and not just the word up there to accommodate for those kids who might not have those literacy skills. And even kids who do have literacy skills, often that extra visual can help them really understand things. Topic related vocabulary. So if you know the unit is going to be on Valentine's Day, just because that just happened, having that vocabulary either pre-programmed in their device or giving them a topic board with that vocabulary on there so that they know like all of this is related to Valentine's. This is what we're talking about today. This is where it's at and what the words my friends are saying also. And then again, scaffolding questions. Are they able to answer yes, no questions? Are they able to answer open-ended questions? And matching the activity to their level. If you're doing group comprehension, call that student out, ask them, hey, was this a bear or a bird? Even though the other kids in the class might be asking higher level questions or more open-ended questions, we can always scaffold those questions down and get the student involved in group discussions by meeting them where they're at. Same question here. What have you guys used in language arts? Jen, we do this with all our book of the week books, and we merge the same book into their library special and use a low-tech communication board to interact with the specials teacher. That's excellent. That's great. Raz Kids is also awesome. I definitely agree. Read aloud, highlight text, comprehension quizzes. Yes, definitely. Yeah, so that's a great question, like matching versus learning concepts. So I don't know how familiar you are with Bloom's taxonomy, but that's something to think about. It's kind of a pyramid of where learning starts, the very basis of it, and how it scaffolds up. And at the very basis of it, matching is a type of learning. So you need to learn that things are the same before you can really learn how to talk about them and discuss them, because you also have to know what's the same versus what's different. So matching is definitely a type of learning. Bloom's taxonomy. I'll type it into the box. And that's just the pyramid of how, especially like Western education systems are set up, where when they're younger, we're just expected kind of that rote learning. And then when it's older, it's more like synthetic and analyzing information. All right. Any other examples of using language arts in the classroom? I mean, AAC in the language arts classroom. All right. So specials, I think we get so focused on those core classes and core needs that sometimes specials fall through the cracks. I don't know the correct phrase. So some ideas here: low-tech or mid-tech custom vocabularies. And again, I think you guys kind of see the trend where that's always something a go-to. If the student doesn't have it readily available for them, we can easily print it, add it, provide it for them in the moment. Like I mentioned earlier, if it's swimming or even pulling away from school and the kiddo loves to take baths at home, what waterproof board or float boards can we use to allow them that access to communication in a wet environment? Providing icon-based instructions. So if they're going to PE class and there's a bunch of steps they need to do, or what's it called? A relay race that they need to do, not just verbally saying it to the class, but also providing them the visuals to show them what's happening, what the expectations are, and what they need to do. And the same with visuals. So you walk into the library and a lot of things are labeled with letters. So fiction, nonfiction, horror books, whatever books, adding visuals to those so that if they can't read, they can at least access the things they like and find the things they like. And then if you're in music class, finding instruments that can be hooked up to switches so that they can control them if the student doesn't have that fine motor ability to use certain instruments, there are different types of cause and effect toys or musical instruments that can be hooked up to a switch where they just have to hit the button or hit the switch and it'll activate that toy or that instrument for them. Any other things you guys have used in different specials or ideas or questions you have in terms of integrating AAC into specials courses? For those of you not from the States, specials are things like art, music, PE, swimming, language classes, like foreign language classes, home ec. That's all I had growing up, but there are so many more. Smart boards, they can use that as a way. Yes, definitely they can use that as a way to pick answers and make choices. I'm also a fan of the buddy system, so finding a buddy in each special, and depending on the age, some kiddos get really excited that their job is to help their friend in this class, and then it also can kind of help fade out that adult support by just having a peer and increase those peer interactions. Anything else? Universal design to making communication systems. Exactly, yep. And that kind of goes back to those playground boards where we're seeing in a lot of places where it's more universal, it's for everyone. So moving on, beyond augmentative and alternative communication, how can we really support our emerging communicators? So not just when it's coming to communication, but just engaging them, giving them access to those same things. So I'm a huge fan of visuals, and I think a lot of times visuals get confused as communication systems. So when we ask a family like, oh, we're thinking about using a PECS, teaching them the PECS program, they'll be like, oh yeah, we use PECS all the time. You show up at their house for a home visit and they just have visuals labeling everything around the house. So that's not necessarily communication. It's just a visual supports. So really using those visual supports to our benefit, but seeing that and understanding that those are separate from a communication system. So some different types of visuals we can use are timers. So whether it's a timer letting them know how long they have to finish an activity, how long they have to do an activity, teaching them a schedule based on time. So like matching the time with the clock. I love when I go into a general ed classroom and there are visuals around the clock to kind of show the time and help everyone tell time a little easier. Schedules, so visual schedules, whether it's using just a whole to-do list and they just have to move it over or just remove it, really showing those visuals and expectations. And this is something I use for a lot of my kiddos, even kiddos who might not have communication needs. Having those visuals can really take a lot of the stress off of different parts of their executive functioning. So having a visual schedule doesn't necessarily just have to be for a nonverbal communicator or a complex communicator. It can be really beneficial for a lot of different clients. Do you suggest incorporating putting schedule and communication on the same device and learning to get in and out of each application? That's a great question, Mackenzie, and I really think it depends on the user. I've worked with kids who have no problem navigating their device, knowing that I need to open TouchChat or Proloquo to communicate, and I need to open this for other activities. And then I also know that I've also worked with students who, the minute they're out of their speech device, open YouTube, and it's near impossible to get them in to do anything else. So I think if you have a learner who's able to navigate their device, I think that's a great skill to teach them. There are also some different features in different devices where from the device they can set a timer or they can open a calculator or something like that. Like I kind of talked about earlier, adding labels with visuals. So in the classroom, we might see different things labeled, but adding in those visuals to make sure everyone's supported and everyone's able to navigate and find things. As well as when we're explaining expectations and rules. If you're able to write a social story, that's great, but if not, and it's just classroom rules, having those visuals alongside, again, to make sure that everyone is given that same opportunity to understand it and have that same level of integration into the classroom, knowing the expectations. I also, again, really recommend using visuals when it comes to rules, or social stories when it comes to rules, for even like higher functioning kiddos who might just have executive functioning difficulties. Oftentimes, being able to visualize things and see it while we're talking about it and explaining can really help make something more concrete than just someone telling a group of people where you have to attend, you have to listen, you have to understand, you have to picture, and you have to remember. Having it kind of written out and visually for them can take away a lot of those parts of remembering and learning a rule that we do so naturally when we don't have those extra needs. And then being aware of our vocabulary. So modifying vocabulary, using consistent vocabulary. So if you're trying to teach a kid in your class to line up with the group, not saying everyone to the door, line up, all right, let's get ready for PE, but always kind of using that same vocabulary just until they get the hang of it. And then you can kind of jump into generalization. For some kids, you might not need to do that. So it's really important to kind of know your students' generalization needs, and classroom needs, and helping the classroom teacher understand those differences as well. Getting to this later, but can you talk a little bit about your experience working with students who are learning 2 languages or more, especially Arabic or English? Yes, I definitely can. So this, just going back to questions parents often ask us, a lot of parents, especially working out here in Dubai, will ask if they should stop talking in Arabic to their kid and only talk in English, or vice versa. However, most recent literature, and a lot more literature recently, has come out that says absolutely not. There's no evidence that learning multiple languages or being bilingual will delay development of language, will confuse a child, will change their trajectory, will change their prognosis. It really is just about language exposure. So going back to like that consistency, as long as we're consistently talking to them and expecting that same communication, it doesn't really matter how it's coming to them. I grew up learning Arabic and English at the same time, and still to this day, there are some words I might not know in Arabic or some words I might not know in English. And growing up, we used to code switch way more often than I can control now. But that's all part of that natural bilingual development. So if a kid is picking up one language faster than the other, that doesn't mean they should only learn that language, and it doesn't mean that it's easier for them. It's just that natural language development with multiple language. True. Is that proven true in kids disabled with a communication disorder as well? Yes. So a lot of the research I've read recently does show that even kids with different disabilities, that bilingualism doesn't impede their learning. And again, like every kiddo is different, but this is what the most recent literature is coming out and saying. I'm more interested in AC for compromised kids. Diverse syndromes, big attention, and cognitive deficits. Yeah, Isabel, can you kind of expand on that question? Yes, definitely. Yeah, Christine, I can pull those articles I've recently read and share them once everything else goes out. You guys are just going to get an email with tons of attachments from us. Yeah. Sure. So if parents ask us which language to teach, Arabic or English, we say both. What about if students' academy is English only? Which language should therapy be focused on? That's definitely up to the parents. When parents ask me which language, I tell them whatever they're comfortable with. If they're comfortable and they want their kid to be a bilingual, continue that route. If they want to pick a language, pick which one long term their child's going to be exposed to the most. But I really leave that decision up to the parents. If they are completely exposed to Arabic only at home and at school, and English is only therapy, then I think that's a little bit different of a situation, whereas they're across bilingual settings across their day. Does that make sense? Yeah, Amina, so there is some research about teaching adult learners to use AAC. Unfortunately, a lot of that research is looking more at stroke patients or people who have cognitive deficits later on, whereas before they were not cognitively impaired. So it does look a little bit different, but there is a lot, and a lot of these same things apply, like that consistency, finding something that matches their lifestyle, finding something that they're able to navigate and understand. For adults, it does typically come down to more of why are they just now learning an AAC system? Is it because they weren't provided the opportunity to, and they've always had communication deficits, or have they been newly impaired and everything is new to them? And so you're kind of navigating it differently in that scope. I see with my kids, sometimes it's difficult to advance in the use of AAC as a communication. Okay, got you, Isabel. Yes, definitely. So, and I think this is where collaboration becomes so important. A lot of times when we're first teaching an AAC device, sometimes we get caught into that scope of requesting, right? We want to teach them the cause and effect. We want to teach them that buy-in of a device. So how do we get them beyond that state of requesting? And I think that's where I've found a lot of success collaborating with my BCBAs and finding external reinforcement to add in when they are engaging in social conversations with their peers, or when they are using their device spontaneously. Like, how can we add in that reinforcement and then fade it out later when they're using their device across different settings? I hope that answered your question now. Man, now the questions are just flowing. I can barely keep up. 1 second. All right, let's see. Amina, yes. So they are going to be so happy to have someone like you who's giving them that chance. And I would definitely approach it that same way. You need to kind of know what their language level is at. So doing different assessments to navigate that, trialing different devices, different systems, getting to know their lifestyle, their expectations for themselves, their family and caretakers' expectations for them, and coming up in that same way. So even though they're older, it's going to look very similar in terms of matching their needs and wants. Any recommendations on embedding AAC within the VB-MAP curriculum, or know any resources to help facilitate curriculum individualized for that learner? That's a great question. I do not know of any resources specific for the VB-MAP or assessment. With the VB-MAP, what we typically do is test with the device. So if a student is using a device and they are able to tact with the device, we do that and just make note of it, that's their form of communication and that's what they're using. Any articles or thoughts on using AAC with kids that demonstrate functional vocal language, but with limited intelligibility, aka children that yes. Yes, so I've actually had a lot of experience working with typically developing kids who have childhood apraxia of speech and putting them on AAC devices. And there are a lot of articles actually recently that have come out supporting that really helps not just their functional communication, but it does then develop into more clear speech and clearer speech for them as they use the device and get to be more proficient in that communication. Can you speak about switching from PECs to a tech-based device? Yes. So my rule of thumb is once PECs has more vocabulary than we can keep up with, or it's vocabulary words are constantly missing from the book, that's when I kind of start to recommend to go into a tech-based device. With that being said, again, it's a team discussion, it's a family discussion. Does everyone feel the same way? And is everyone willing to switch that device to that device? And then when it does come to switching it, depending on the student, sometimes I write a social story explaining why the switch is happening. And sometimes I collaborate with the BCBA to kind of come up with a fading process so that we're not taking away communication before they're learning how to communicate. And sometimes it might just be leaving both out and then increasing the expectations to use the tech-based device while slowly lowering the expectations for the PECS device. But introducing a new device does get a little bit tricky because we don't want to just leave them high and dry while they're learning something new. We still want something they're fluent with to be available. What options are there to make speech generating devices a good cultural and linguistic match? Yeah, so they have so many different voices now on speech devices. You can change the rate, you can change the tone of voice, you can select different voices, you can download voices with accents. I always let my students, if they're capable, I always let them pick what icons I'm putting in. So if a kiddo asks me to put in mango, I'll type in the word mango and ask them to select which one represents mango to them. I've never really worked with a kiddo who has advocated or been able to share a preference of the voice or any of that. But if you are working with a student who does have those skills, I would definitely get their input on which voice do they want to be theirs. Fun fact, there's also a company called Voice ID where they do voice banking. So what they do, anyone can do it. You just have to read things off of a screen and it banks your voice. And then they start to use your voice paired with other people's voices to come up with these more natural voices on speech generating devices. And that's how we've kind of come from that robotic output to more natural speech. Any other questions right now? All right. So this is the Communication Bill of Rights I'll pull up in a minute, but it really just describes that everyone deserves a voice and communication is powerful and nobody should be stopped from having that right of communicating. So let me just pull it up real fast and figure out how to share it. Hold on. All right, can you guys see the Bill of Rights now? Sharing content from one another. Can you guys see it, but is it blurry to you? Yes, it's blurry, or yes, you can see it? Because for me, it just got really blurry. Okay. It's blurry. Okay, let me try to fix this again. How about now? Okay, it's because I switched my screens. All right, so this is the Communication Bill of Rights. And it just goes through 15 different rights that anyone with a disability, regardless of the extent or the severity, these are just the basic things that they have a right to, just being a person, and things that we should keep in mind as we are finding the best mode of communication for them and working with them to find that. So I won't read them all, but I'll go through a few of them. They have a right to interact socially, maintain social closeness, and build relationships. They have the right to refuse or reject undesired objects, actions, events, or choices. They have the right to ask for and give information, including information about changes in routine and environment. They have the right to be informed about people and events in one's life. They have the right to have communication acts acknowledged and responded to even when the desired outcome cannot be realized. They have the right to have access to functioning AAC and other assistive technology services and devices at all times. They have the right to be treated with dignity and addressed with respect and courtesy. And they have the right to have clear, meaningful, and culturally and linguistically appropriate communication. So obviously there's a lot more here, but the ones I chose to read out loud kind of highlight everything we've talked about today. So the right to refuse or reject undesired objects or actions. This kind of takes us back to the vocabulary we're choosing to put in, fringe word versus core word. Do we have enough vocabulary? Like you guys at the very beginning, did anyone have no written down or stop written down? Would you have been able to refuse or reject something? The right to interact socially, maintain social closeness, and build relationships. Are we putting them in an environment? Yes, it may be inclusive in terms of they're sitting in an environment with peers, but are we educating the peers? Are we helping them interact with the peers in a way that they can build relationships? And then the right to have access to a functioning AAC device. This takes me back to the piano quote. We can't just hand them an AAC device and say, see you next year when I write your IEP. it's an ongoing process. It's constantly changing, developing, and matching their growing needs as they continue to grow and learn. And then, like everyone in the video said, just the right to be treated with dignity, addressed with respect and courtesy, and just talk to the way we would talk to anyone else. Whether that means giving them more wait time and being more patient in communication, just allowing them to have that dignity when communicating and all the time. And then just because we have so many people from all over the world, understanding how important cultural and linguistically appropriate communication can be and how meaningful that can also be when you're trying to get a family to get on board with AAC. Any questions about the Bill of Rights? All right. This next slide just lists some resources for you guys. That AAC Language Lab is the one I mentioned earlier, where you can kind of get information about funding and how to do the funding process depending on where you're at. And then just different websites as well. Hello, Angela. Any chance you are able to touch on errorless learning when using AAC? Perhaps I missed this earlier. That is a great question. So errorless learning and facilitated communication are obviously a very fine line. Oh, you can't see my screen. I'm so sorry. One second. How about now? Oh, is it sharing too now?
Hi, Dr. Tina. We see your slides, but we see your notes, so it's like a presenter view.
Oh, that's so weird. Okay, here. There we go. How about now? Yes, great. Thank you. All right, so these are just some resources. You guys will have access to them with the slides, just different websites, different blogs, different places where you can get a lot of information and also reach out for help. Going back to Angela's question about errorless learning with an AAC device. So this is always a fine line when we're thinking about facilitated communication versus errorless learning. And I think it really is important to collaborate with your BCBA team and understand the importance of errorless learning for that learner, if it is important, and understanding that if you are doing errorless learning, it needs to be in the context of you knowing exactly what the target response is and not ever preventing them from saying what they want. So, man, so much technical things happen when you share a screen. 1 second. Am I back? Great, I think I am. Okay, so like I was saying, if you're sitting there teaching a child how to tact pictures and you're holding up the picture and the child's just talking about food all day, I would stop, take that time, ask them if they're hungry. If it's yes, and it's an appropriate time for a snack, honor that and jump back into tacting. If they're just going in and totally avoiding, and then that's when we can kind of go in and follow a prompting method prescribed by the BCBA to make sure that they are errorlessly learning how to tact. We never want to be doing facilitated communication where we're speaking for them, making them make forced selections, but there is benefits to using errorless learning when we're teaching a child how to achieve different academic goals and skills for learning purposes. So I think errorless learning is great when we're thinking about teaching and in that academic setting, but when we're looking overall at communication and just their day-to-day freedom to communicate, that's where it gets a little bit different and we're not necessarily looking at that errorless learning as much. I hope that answered your question. I could talk about this for hours, so I don't want to go too deep into it. All right, and here are my list of references. And then on this last page, some recommended applications. These are all available in both Google and Apple stores. And that is all I have for now. What questions do you guys have for me? Any other questions, comments, ideas? Oh, the collaboration question. Thanks for asking. I'm not going to lie, collaborating with BCBAs can sometimes be very, very hard. I think we have a lot that overlaps, and so we can both become very protective of what we know and what's ours. But I think just really like leaving your ego at the door, going into this knowing that you're working with your counterpart, whether it be your BCBA or your SLP, for the better of the student, and knowing that yes, we have very similar backgrounds and very similar skill sets, but we also have very different skill sets and things we've learned within our scope of practice. So I think the most effective collaboration I've had is just coming to the BCBA, being like, this is my thoughts, these are my ideas, you tell me yours, let's see where we match up, let's see where we disagree. And at those disagreements, let's talk about them, not fight about them, but kind of share why we think this and why we think that, because every time the BCBA has a great point, like, oh, we would never do this because of X, Y, and Z. And I was like, oh, well, we would actually do this because of X, Y, and Z. So really understanding your BCBA's perspective, their learning, their knowledge, and just leaving your ego at the door and being willing to have someone tell you, no, I don't want to try your idea, let's try mine first, and being okay with that, because no one's here to harm the children. It's just different styles and different approaches. Thank you all for attending. I'm glad you've all enjoyed it.